Hello and welcome to the Parkinson's Foundation's webinar on resources for veterans with Parkinson's. I'm Krista Ellis, your host for today's webinar. Helping me behind the scenes are my colleagues Danielle Agpalo and Laura Cameron. More than 110,000 veterans with Parkinson's disease receive care through the U.S. Department of Affairs. Many U.S. military veterans with Parkinson's have access to specialized medical care and financial assistance through the VA. During this webinar, we will dive into an exploration of the extensive resources and dedicated support services that veterans have access to through the VA and the Parkinson's Foundation. Today's webinar and the entire Veterans Webinar series is presented with support from the Don and Lorraine Freeburg Foundation. We want to take this moment to thank the Freeburg Foundation for helping to make these programs possible. The mission of the foundation is to make lives better for people with Parkinson's, whether you are living with Parkinson's, caring for someone with Parkinson's, or working to end the disease. We are here to support you. To achieve our mission, we pursue three goals: improve care for everyone with Parkinson's, advance research toward a cure, and empower and educate our global Parkinson's community. Today's program is a great example of one of the things we are doing to help us meet these goals. The Parkinson's Foundation hosts weekly education and wellness programs through our PD Health at Home virtual programming. Join us for Mindfulness Mondays, Wellness Wednesdays, and Fitness Fridays. Most of the PD Health at Home programs are recorded and posted on the Foundation's YouTube channel. You can scan the QR code on the screen to connect to that channel or find out more and register to attend our live PD Health at Home programs at parkinson.org/pdhealth. Part of the foundation's commitment is to reach every person living with Parkinson's. A critical way we do that is through our partnerships. With more than 110,000 veterans living with Parkinson's disease, the foundation is proud to have established a formal partnership with the Veterans Administration. This partnership has the overarching goal to improve the quality of life for veterans living with Parkinson's disease and their care partners through greater access to education, resources, and support. I'd like to invite you to visit our webpage and explore the resources offered by the Parkinson's Foundation that can support your navigation of living well with Parkinson's as a veteran. That website is parkinson.org/veterans. Before we dive into the formal part of the webinar, I'd like to outline today's agenda. We'll start with a presentation from the Associate Director of Education, who will discuss the resources available to veterans with Parkinson's. After that, we'll have a question and answer session. Then we'll move on to a second presentation, providing an overview of VA disability benefits led by a veteran service representative, which will also conclude with a Q&A session. We're happy to kick things off by welcoming Gretchen Glenn, a dedicated social worker and the Associate Director of Education at the Philadelphia Parkinson's Disease Research, Education, and Clinical Center. With a deep commitment to helping veterans and their families, Gretchen specializes in guiding individuals through the challenges of chronic illness. Her work focuses on disease education, supportive counseling, resource coordination, case management, community outreach, all centered around those impacted by Parkinson's disease and related movement disorders. In addition to her work at the center, Gretchen leads as the chair of the National VA Parkinson's Disease Consortium Education Subcommittee. In this role, she plays a crucial part in providing educational resources to VA healthcare providers, ensuring veterans with Parkinson's disease receive the best possible care. Gretchen's passion for helping others shines through in everything she does. She has dedicated her career to supporting individuals as they navigate the complexities of chronic illness and end-of-life care. Gretchen, we're truly grateful for your time and expertise today. Thank you for being with us.
Good afternoon, everyone, and thanks for having me present today. So first, I'm just going to review what we're going to talk about. I'm going to give you an overview of the PADRACs and the National VA PD Network. Going to go over a little bit about the eligibility for care at a PADRAC or associated site, and then review some of the VA resources available to veterans receiving care at the VA. So the Parkinson's Disease Research, Education, and Clinical Centers, otherwise known as the PADRACs, were established in 2001 by the Department of Veteran Affairs to revolutionize services for the then approximate 80,000 veterans afflicted with PD. That number has since grown to 110,000, and research is currently happening to obtain a more accurate number. Each PADRAC is designed to deliver state-of-the-art clinical care, research, and education to an expansive geographic region, which we refer to as our service area. All these centers are staffed by movement disorder specialists and researchers. The 6 VA PADRACs are located at the Philadelphia, Richmond, Virginia, Houston, Texas, West Los Angeles, San Francisco, and a split center in Portland and Seattle. The National VA PD network was established in 2003 to broaden the impact of the PADRACs and promote PD awareness across the VA healthcare system by providing professional networking, mentorship, and training to VA clinicians and allied health professionals who have an interest in PD and movement disorders. The PADRAC associated sites were launched in 2006 to broaden the impact and reach of the PADRAC mission and provide access to specialized movement disorders care throughout the VA healthcare system. The PADRACs and over 60 associated sites create a hub and spoke model of care. In 2020, the PADRACs were fortunate to form a partnership with the Parkinson's Foundation. And as you can see from this map, many of the PF Centers of Excellence are close to VA PADRAC or associated sites. So you can see on the map, the blue dots represent the Parkinson's Foundation Centers of Excellence. The red dots represent the 6 PADRAC centers, and the gray dots represent the over 60 PADRAC associated sites. So as you can see, the PADRACs sort of outline the United States, sort of like a necklace around it. So in order to provide care to our veterans across the United States, that was the reason why we developed the PADRAC associated sites to make accessing our specialized care easier for our veterans. So now to review our PADRAC mission, of which is clinical care, education, and research. Our clinical services, we provide a multidisciplinary team approach, which can include attending neurologists, movement disorder fellows, nurses, nurse practitioners, geriatric psychiatry, neuropsychologists, social workers, pharmacists, PTOTs, speech therapists, and several others. The PADRACs all do diagnosis and treatment of movement disorders, DBS, and focused ultrasound evaluations for Parkinson's disease and essential tremor. Neurostimulation for DBS, which is adjustments of the DBS device. Botox for injections for dystonia, hemifacial spasms, spasticity, and other indications requiring injections. Neuropsychiatric assessments, looking at the cognition of our veterans. Disease education, psychosocial assessments, palliative care discussions, which can include goals of care conversations, advanced directives, and help in treating more difficult complications related to Parkinson's disease. And we can also make referrals to PT, OT, and speech therapy. Our education program is twofold. We have patient education and professional education. So our patient education programs, we provide monthly virtual support groups, annual symposium, which are in-person and or virtual, distribution and creation of print and media resources, and we do a lot of community outreach. And you can visit our website that's listed here to see a full listing of our education opportunities. Professional education consists of movement disorder fellowship program, where we train neurologists who want to become movement disorder specialists. We provide 2 movement disorder webinars a year, which are about 4 hours in length and are open to any VA clinician interested in learning more about Parkinson's disease and movement disorders. And monthly case conferences and journal clubs for our associated sites to discuss and explore difficult cases that they may be experiencing. On this slide, this shows you our PADRAC education and support groups that are currently happening. They're open to anyone, so if you're interested in joining, you can reach out to the contact person listed, and they will provide you with the meeting information. The PADRACs have a very robust research program. So this is not an exhaustive list, but I'm just going to go over some of them with you. We do surgical interventions, research and surgical interventions, the VA and the NIH completed the first large-scale trial of DBS, known as Cooperative Study 468, and this was conducted at all 7 PADRAC sites. Drug therapies, we are currently doing a multi-center study comparing the antipsychotics pimavanserin and quetiapine. Research into gait and falling issues, depression and other psychiatric problems, non-motor fluctuations such as anxiety, urinary incontinence, sense of smell, sleep issues. Looking at the benefits of exercise in Parkinson's, basic science or lab studies looking at the cause, treatment, and hopefully cure for Parkinson's disease. Looking at drug-induced Parkinsonism and the long-term exposure to antipsychotic medications such as lithium and Haldol, gene mapping and genetic predictors, biomarkers to help diagnose PD earlier and with greater precision and track progression, and toxin exposures, looking at the environmental, chemical, and toxin pollutants like pesticides like Agent Orange and paraquat that are especially of interest to our veteran populations. And a lot of that research has helped to make Parkinson's a presumptive service-connected condition, which I'll explain later on in this presentation. So if you're a veteran, how do you access healthcare through the Veterans Affairs? So some eligibility factors are service history, VA disability rating, income, and other factors. But to be eligible, first, you have to have served active military, naval, or air service, did not receive a dishonorable discharge. And if you served in the reserves or National Guard, it depends on your active duty status. If you are a service-connected veteran, you are eligible for VA healthcare through the VA, but you still need to apply for it. And the PACT Act has also expanded eligibility for veterans, so it's definitely worth applying to see if you are eligible. And you can go to this website, the va.gov healthcare eligibility website, to see if you're eligible and even apply online. So how does a veteran get care at a PADRAC or associated site? So first, you must be enrolled and eligible for VA healthcare. You would then choose a PADRAC or a PADRAC associate or a Parkinson's associated site to receive care. And you go to our Getting Care page to find a center close to you. You would then ask your VA primary care provider or neurologist to make a referral to a PADRAC or associated site using an interfacility consult. Now, if you need any help with this process, you can reach out to our National PADRAC Network hotline at 1-800-949-1001, extension 205769, and we'll be happy to provide you some guidance. So before we move on, I want to go over some important VA lingo, and that's what does service-connected versus non-service-connected mean. These terms are important as we move forward talking about VA resources available, and they're terms that you'll hear often within the VA system. Service-connected refers to veterans who are disabled by an injury or disease that was caused or aggravated by military service or occurred while serving in the military. Parkinson's disease is considered a presumptive condition for some veterans, which means that it's presumed that the disability is caused by military service if you served during specific wartime and or exposed to certain toxins. Veterans who are service-connected receive a disability compensation, which is a tax-free monetary benefit, and the amount is based on the determined level of disability. Non-service connected refers to veterans who have a disability or health issue not related to their military service. So veterans diagnosed with PD who do not meet the criteria for a presumptive service-connected condition may be eligible for some VA benefits under the non-service connected status, but typically there's an income limit. Veterans who are non-service connected might be eligible for a VA pension, which is a tax-free monetary benefit payable to low-income wartime veterans. So veterans who are eligible for a pension and are also housebound or require the aid and assistance of another person may be eligible to receive additional monetary amounts. It's just important to note that you can apply for VA service connection without enrolling in VA healthcare, but it's strongly recommended you do so in order to receive all the benefits you are entitled to. So now we'll talk briefly about military exposures and PD risk. So when the PADRACs were first established, Parkinson's was not a service-connected condition. But in 2010, it became a presumptive service-connected condition for veterans who served in Vietnam era and were exposed to Agent Orange. In May of 2021, Parkinsonism was added to the list of presumptive conditions associated with Agent Orange, and the exposure locations continue to expand, most recently with the PACT Act adding 5 new locations, which I'll show you on the next slide. In 2017, VA announced Parkinson's disease as a presumptive service-connected condition for veterans who were stationed at Camp Lejeune during a specific time period, and this is due to the water contamination. It's important to note that Parkinsonism has not yet been added to the presumptive condition list. In 2013, Parkinson's disease and Parkinsonism were recognized as secondary conditions to service-connected moderate or severe traumatic brain injury. The PACT Act and Parkinson's disease expands VA healthcare benefits for veterans exposed to burn pits, Agent Orange, and other toxin exposures. Parkinson's was not added to the list of presumptive conditions for Gulf War and post 9/11 veterans related to burn pits and toxin exposure. For now, we're hoping that that'll eventually change. The PACT Act expanded Agent Orange presumptive conditions, including by adding the 5 additional locations where Agent Orange was potentially stored or present. So if you're a veteran, how do you go about applying for VA service connection if you believe that if you do fit in one of those criteria for a presumptive condition? So the veterans, just to give you a little bit of an understanding of how the Department of Veteran Affairs is set up, the Veterans Health Administration and Veteran Benefits, we both fall under the umbrella of the Department of Veteran Affairs, but we function quite separately. VHA, or the Veterans Health Administration, is the healthcare system, and VBA is the financial benefit side. That also includes financial assistance to veterans. VHA can provide medical support for VBA claims, but determination of claims is done by VBA only. So to apply for VA service connection benefits, you'd want to contact Veteran Benefits Administration by calling their hotline number at 1-800-827-1000. You can visit their website here, or you can connect with a veteran service officer, which is something we strongly encourage veterans to do to help in the disability claim process because it can be complex and confusing. And we're going to have Johnny, a VSO, talk to you shortly about the role of a VSO and how that they can help you. So now just to give you a brief overview of some of the more common benefits that a veteran following at a VA can receive. So just note this is a highlight of VA benefits. It's not an exhaustive list. There might be different eligibility criteria and copays for many of these benefits. They can depend on income, service connection, status, level of care required, and even what VA you follow at. But all veterans are assigned a primary care team. This also includes the inclusion of the pharmacy benefit. But a primary care team consists of a doctor, a nurse practitioner, a nurse case manager, and oftentimes a social worker. They're really your director of care. We also have a very robust mental health care services for our veterans. We provide rehab services such as PT, OT, speech, kinesiotherapy, recreational therapy. We also have contracts with many adult day healthcare centers in our communities that can provide increased socialization and supervision during the day, as well as provide some caregiver relief. Contracts with home health aid programs to provide assistance with personal care, such as bathing, dressing, and grooming. Respite care services, again, to give care partners a break. Home-based primary care program is for veterans who have great difficulty or are no longer able to leave their home for care. They will bring the primary care team to you. You have to live within a certain mile radius of a VA medical center to be eligible for this. But they have everything from doctors, nurse practitioner, nurses, social workers, pharmacists, psychologists, and rehab specialists that can all come to your home if needed. Hospice and palliative care, again, to talk about goals of care conversations, difficult treatment decisions, and advanced directives, as well as end-of-life care. Prosthetics equipment, also known as durable medical equipment. So this can range from anything from button hooks to reachers to stair glides to walking aids such as walkers, wheelchairs, and scooters, even having grab bars installed into your home. There needs to be a medical justification for the equipment, and oftentimes requires an assessment by a physical or occupational therapist. But we always recommend to our veterans to ask us or your primary care team if you are in need of any of equipment. Let us have an assessment done, determine the need, and we can order it for you if we're able. If you purchase it on your own, the VA won't reimburse you for it. Veterans who are 70% service connected or more may be eligible for VA nursing home placement or payment at one of our community nursing homes. And then we have our caregiver support program, which there's two levels to that program. There's the general caregiver support program, which is the core program that provides peer support, mentoring, skills training, coaching, telephone groups, online programs, and referrals to resources for caregivers of veterans. And the second part of that program is a comprehensive program, which offers enhanced clinical support and services for caregivers of eligible veterans who have serious injury or illness and require in-person personal care services, among other various requirements. Caregivers eligible for this program also receive a monthly stipend to be their veterans' paid caregiver. And you can contact the National Caregiver Support Hotline number listed here to learn more about that program and if you're eligible. And to learn about any of the resources that I mentioned above or benefits that I mentioned above, you can ask to speak to your VA social worker who can help assess what your needs are, what might be available at your VA, and what you might be eligible for, and help facilitate those referrals. So how do the PADREX and the Parkinson's Foundation Centers of Excellence work together? So we do a lot of co-practice, and co-practice really means that veterans who are eligible for movement disorder care at a VA do not need to give up their community neurologist. And that's what we refer to as co-practice. So the PADREX and the Centers of Excellence are really about working together to ensure veterans are receiving the best possible care with access to all eligible benefits. So if you have a community neurologist that you have had a relationship for a long time, we don't expect you or ask you to give up that community neurologist. But we do ask that you pick one person, either the community neurologist or the VA neurologist, to make the medical decisions for you. That's just for a safety reason. So we don't want to have two hands in the pot messing around with your treatment. If you decide to keep your community neurologist, you just need to come to the VA at least one time a year to receive your VA benefits such as medications, durable medical equipment, in-home support programs, and all of those services I mentioned previously. And that goes the same for your primary care provider. If you've had a relationship and follow with a primary care provider for many years, we don't ask you to necessarily give up that provider. But again, you must come to the VA at least one time a year to maintain your benefits. We do shared fellowship programs with our centers of excellence and our university affiliates. So for example, at our Philadelphia VA, we have 4 fellows who spend half their week with us at the Philadelphia VA and half their time at the University of Pennsylvania. We do a lot of joint patient education programs together. Our physicians have shared appointments at the university affiliate, many of which are PF Centers of Excellence, and we do a lot of research collaboration. So again, we are interested in working together to ensure that our patients receive the best care possible. We're not interested in taking anybody's patients away from them. It's all about getting the care and the benefits for the patient. So I know that was a lot of information. So who can help you with that? Who can help sort a lot of that out for you? So VA social workers can assess your needs and make you aware of the availability and eligibility of services, and we can help advocate for you. I always refer to myself as a resource person. If I don't know the answer, at least I can try to help point you in the right direction. So if you're receiving care at a VA, you should always ask to speak and make a connection with your VA social worker. VA veteran service officers can help applying for or increasing VA disability benefits. So this is the service connection benefits. They can help with the process, which can often be complicated and sometimes overwhelming. And the VSO can monitor your claim and again, advocate for you. And again, Johnny's going to talk to you in a little bit about the role of the veteran service officer. So, just to highlight the partnership between the VA and the Parkinson's Foundation again, which was really formed to improve the health, well being, and quality of life of veterans living with PD. We developed many resources together. So, there's veteran specific webpage, which is parkinsons.org/veterans, where you can find information on PD and veteran benefits, stories from veterans living with PD, connections to veteran specific events such as these webinars. We also have fact sheets, and we have a newly updated veterans guide that really goes over all of what I just spoke about today in a little bit more detail and has all the links to the different web pages and contact numbers that might help you in navigating the VA system. And here's just a listing of additional resources from the Parkinson's Foundation. There is the National Helpline, which we have done some training with the helpline on VA and veteran benefits. And we work very closely with them so that if a veteran is having a hard time connecting to a VA, the helpline staff is more than willing to reach out to us and we'll help problem solve and try to help break down some of those barriers. But I suggest that you check out some of these other valuable resource information from the Parkinson's Foundation. And again, this is a list of important contact information. All these slides are going to be shared with you at the end of the presentation. And many of them are the links that were presented in the presentation today to help you navigate through the VA system. So just thank you, everyone. Now I'm going to invite my colleague, Emily Hall, to join me for our Q&A session.
Hi, everyone.
Hi, Emily, welcome back. And thank you, Gretchen, so much for pulling us through how to navigate these benefits with the VA in collaboration with the Parkinson's Foundation, and also highlighting the partnership that does exist and is impactful in supporting our community of veterans who are living with Parkinson's. I appreciate the way that you've outlined this for our community, and knowing that we can revisit it again once we post the recording later on. So the first question is from Dan and Donna, and they ask, what types of home modifications can I get support from when the time comes?
So through the VA specifically, if you're a veteran and you're enrolled in the VA healthcare system, there's grab bars that can be installed into your home, stair glides, ramping, if that's necessary to help get in and out of the home. There is a HISA grant, HISA, which is a one-time lifetime grant that a veteran can apply for that could make like the bathroom more accessible. And we know getting in and out of the shower and tub can be difficult. So you could get a grant, may not pay, likely won't pay for all of it, but it could go towards the renovation of a bathroom for like putting in a walk-in shower or a roll-in shower. Pretty much, there's a lot that we can offer, and but a lot of times what we would do is send out a physical or occupational therapist to your home to assess your home to determine what modifications would be needed, what type of equipment would be needed. They would contact us, and then we could see what we could get through the VA or if there's a certain grant that could be supportive for that.
Yeah, and I would definitely agree with, I think consulting with your rehab or therapy team too, because I know here through Richmond, one of the rehab therapists has to put in that referral to prosthetics for the HISA grant with the medical justification, what's needed. But also, as Gretchen said, it doesn't necessarily always cover everything that you need done. So sometimes what people will do is use that grant and also apply for a community grant. So if you check with your local VA social worker, kind of check in your community if there are different programs. Like for example, in Virginia, we have Granting Freedom, which is a specific grant for Virginia veterans too. So sometimes people will use that and the HISA grant, and that can cover a lot of the cost. But yeah, I think that's the majority of it. There are a couple of other disability housing grants that are a little bit more intensive and definitely a lot more difficult to get. Um, that's on available on the va.gov site. They're called disability housing grants. These are applications submitted directly to VBA, the Veterans Benefits Administration, and they have a lot of very specific clinical criteria to meet in order to qualify. So I would say the HISA grant is typically the best way to go. The other two grants are a lot more difficult.
Thanks, Emily, for highlighting that there are grants available to support types of home modifications that Dan and Donna were asking about. So appreciate you both, Gretchen and Emily, for highlighting the types of modifications that could be provided through VA benefits and also allowing us, giving us another opportunity to explore resources that could further support those home modifications. Bill is asking us, how is research coordinated across the PADRACs to optimize results?
I know each, and you can correct me if I'm wrong, Gretchen, because this isn't my realm as much, but I believe each PADREC has a research coordinator, correct?
Mhm.
That so they are running their own studies either locally or if they're nationally, and they all kind of communicate with one another. I know that the big study that I'm aware of is the Vet PD research study that they're doing also with the Michael J. Fox Foundation. But I'll let Gretchen speak a little bit more to that too, if
No,
you
no,
have
you're right.
anything to
All of
add.
the PADRAC. So for each mission, there's each PADRAC has an associate director attached to that. So an associate director for research who really oversees the research going on locally. And for the ones that are being done more nationally, they do meet, it's either once a month or bi-monthly, have a research call that all the PADRAC's associated sites who are doing research can come together, discuss what research they're doing, opportunities for maybe collaborating together. And as we mentioned, there have been some collaborative studies, and they're strictly monitored and really are working together. We are having a national meet. We do have a biannual network meeting. We're having one next week, and that's one of the topics as well, is talking about research and the possibility of collaboration in the future. How can we further collaborate together for the research projects for our veteran population?
And I'll add that optimizing results in research for Parkinson's and veterans requires participation from veterans with Parkinson's. So I'll just advocate for participation in clinical research at our PADRACs and centers across the globe. So thank you for the question, Bill. Jan is asking, can you talk more about financial considerations for care? What are the income limits?
For VA specifically?
Yeah, when you're considering financial care, financial considerations for VA benefits, are there income limits to receiving the benefits from the VA? Restrictions on income?
So if you're a non-service connected veteran to be eligible for VA healthcare, there is an income limit, and I'm not exactly sure what that number is. Do you know, Emily?
So I actually was looking it up and I'm having trouble finding sharing the link. But so everyone's income limits differ based on where they live.
Live.
So I was trying to find the actual website where you can look it up. Because what somebody's income limits as a single versus a dependent versus living in Virginia versus living in California, they're all very different. So they do it based on that, and they do change annually. Um, I don't know. Let me see if I can put you all might be able to share these in the chat, but they look the at your income limits and we'll see if you're one eligible for care. But I know, in reading the information as well is that they're trying to lower that a little bit, lowering the income limit because there have been a lot of veterans in the past who have, quote unquote, made too much money to qualify for care. So they're gradually trying to work to lower that income limit so more veterans can use the VA for care. But sometimes that also means that they might have to pay a copay to get care. Um, Now, the most important thing is just making sure that when you're updating your income as much as possible, retry and do it at least annually, because that determines a lot of eligibility for different services. As far as for like benefits and income and things like that, I know Johnny's going to be presenting in a little bit, but there's no, to my knowledge, no income limit when you're applying for a service connected disability condition. Now, the VA pension is an income-based benefit. So in that, they will kind of look at how much money you're making, and that could potentially determine the benefit payout per se.
But all of it is listed on the website, and you can go to the VA apply for VA healthcare page, and it gives you the breakdown on there, and you can actually start plugging in your information to see if you're eligible. I always tell people just apply and let the VA make the determination if you're eligible or not,
Mhm.
because there's many factors that play into that. And even if you had a copay for care, even if you were eligible for VA and had a copay, it would be about like $20 for primary
Mhm.
care, $50 for a specialist. Um, and if you have private insurance on top of that, not Medicare, but a private insurance on top of that, they can bill part of that to your private insurance. So it may be less. So I just always say if you're a veteran, apply for VA healthcare, let them make the determination to see if you're
Mhm.
eligible.
Thank you, Gretchen and Emily. Appreciate it.
I put
John,
some links to you all if you're able to share them too.
absolutely. Thanks for sharing those links. That's helpful. Emily, and feel free, Jan. Uh, Anyone who's interested in income considerations, go ahead and click those links in the chat, and it'll pop open a new tab on your browser for you to browse after our program today. Our viewer Jonathan shares that they live in the Florida Panhandle. The closest VA center with PD support is 4 hours away, one way. How
Mm.
is it provided to veterans like me?
So we do a lot of telehealth. We have a lot, even prior to COVID. The VA was one of the leaders in providing telehealth care to veterans who are in more rural areas. So if a veteran isn't able to get to us or an associated site, we are happy to, again, you can ask your primary care provider to reach out to your local site, or you can contact us directly and we can work with you to try to get you connected to have even a video visit with one of our PADRAC or associated sites. So
Mhm.
we are happy to do that as much as we can.
And
Yeah, I would agree.
it's a testament to being connected here in the virtual world. We're already
Mhm.
doing some form of health education here and empowering yourself to get connected through more support and quality care by way of the World Wide Web. So it is possible. Thank you for highlighting
Yeah.
that.
And we're always looking and spreading awareness across the VA system for other providers in other areas so that we can expand our associated sites locations as well.
Mhm.
There's a couple of specific questions in here related to service connected and non-service connected. So Franz is just asking, what does non-service connected mean? What are benefits for non-service connected veterans?
I know Gretchen touched on this in her presentation, so she can probably say it verbatim now at this point. But it essentially means that that individual veteran does not yet have a rated service-connected disability condition. Um, and that can range anywhere from 0% to 100%. So I have seen where somebody has had a 0% disability rating before, but that's because that condition they're no longer getting necessarily treatment for. But non-service connected just means that they don't currently receive, they're not, you can speak on
That's
it.
okay.
Yeah.
So it's a veteran who's eligible for
Yeah.
VA healthcare. However, they didn't have an injury or illness that is
Yeah.
connected to their service time. So the
Hmm.
disability rating for a service-connected veteran is related to if you served and if you had an injury or were diagnosed with an illness while serving active duty or have one of the presumptive service connected conditions like Parkinson's related to Agent Orange, non service connected veterans. So we have a lot of non service connected veterans who have Parkinson's disease, but were never in an area where they were exposed to Agent Orange. So they cannot be service connected for their Parkinson's if they were never in an area where Agent Orange was located, but they are still eligible based on the income limits to receive care at a VA. So being service connected
Hmm.
not only gets you the disability compensation check each month, which is the monetary benefit, but it also may give you more. You wouldn't have a copay for your care. You wouldn't. You'd be eligible for some of like if there was ever a hold on home health aid with if it was only eligible for a service connected veteran, you would be eligible for that. Nursing home level of care, if that's needed, you have to
Hmm.
have a service connected rating for to be eligible for that of 70% or more. So being service connected may give you access to additional benefits over
Hmm.
somebody who's non-service connected, but you can still receive medical care as a non-service connected veteran. You just may have a copay for some of those things. I hope that made
Mhm.
sense. It's a confusing process.
Yeah, that was a really good explanation.
Thank you.
Thank you, Gretchen. And that did answer Linda's question specifically on are nursing home services only available to service connected veterans? I believe you said yes, only available to service connected veterans.
Yes.
So 70% or higher, specifically, or I think that there are
60%.
some,
Yeah,
yeah,
60% and
special.
unemployable, but that gets even more complicated. So I just say if you think just talk to a VA social worker. They can pull up your record, sit down with you, and go over all of this with you on a personal basis.
And that's eligibility through the VA. So if you are eligible for Medicaid, like state Medicaid and different things like that, you still have opportunities for long-term care, just not necessarily covered by the VA. So kind of, in planning for the future and kind of thinking about the future, that's why it's very helpful to try and start pursuing and registering and applying for things early so that when the time comes, if you do need long term care, you already have everything kind of in place. So you have a plan set up for the future.
Thanks, Emily. Our next question comes from Suzanne, and they ask, what's the difference between a VA clinician, a VA social worker, and a veteran service officer?
So a VA clinician, I would think that be more of your primary care doctor or nurse practitioner that's or your movement disorder specialist who's managing your medical care. A VA social worker, that's Emily and I, we do more of the resource coordination, looking at what you might be eligible for through the VA, doing supportive care and disease education, talking about planning for the future and long term care planning.
Hmm.
I like to refer to myself, and I'm sure Emily does as well, as like, I'm like your resource person. If I don't know the answer, I can
Hmm.
at least try to find it for you or point you in the right direction. um, a veteran service officer works on, and so we work in the medical side. So we're under that VHA, Veteran Health Administration. Veteran service officers fall under the Veteran Benefit Administration, which is the financial benefit piece of the VA. So they're really the experts in applying for compensation disability benefits, housing grants, vocational resources for veterans who are newly coming out of the military, accessing their education benefits, et cetera. That's the veteran service officers, and that's their area of expertise.
Hmm.
Thanks, Gretchen. A question I think is really important to ask as we think about additional services provided through the VA. Who do we contact for occupational therapy or physical therapy services through the VA? And this question comes from Paula.
I would say start with your local VA clinic. Now, because your primary care can definitely request that. Now, if you want to try and have someone that's a little bit more Parkinson specific or maybe certified in some of those different programs like LSVT, BIG, even for speech therapy like Speak Out, Power Moves, all of that. Um, if you can't really find it locally, a lot of the padracs, I know specifically for Richmond, all of our therapists actually do telehealth too. I know as crazy as that might sound, thinking about physical therapy done via telehealth. But for certain patients, it does work really well. And sometimes what they can even do is, a couple sessions of education or ordering specific equipment. Because the great thing about telehealth, if you're talking to an occupational therapist, is they're automatically beamed into your house so they can see what you need. They can look at you, take measurements of doorways, and help order specific pieces of equipment and things you might need. But if you're having trouble locally, start with your primary care provider. But if you are connected to a PADRAC center, trying to find someone who's a little bit more specialized with Parkinson's might work in your favor for
And
certain.
if you can't get it through your local VA, then we can do
Mhm.
primary care doctor through the VA could see about getting it through VA community care, which is if
Mhm.
a VA can't provide it, we can provide that care through a a contracted provider in the community that might be closer. Or if you live 3 hours away from a Padrac that has somebody that can do LSVT big, and but you have a rehab that's 2 miles down the street from you, we might be able to, if we have a contract with them, you might be able to go get that care closer to home than traveling 3 hours, which is not reasonable. So bottom line, talk to your primary care provider. If you're hooked into a Padrac, talk to your Padrac or associated site about therapy, and they'll help get you connected and get you started.
Thanks, Emily, and thank you, Gretchen. One of our anonymous viewers is asking, there are accredited and non-accredited VSOs. How do we know the difference?
Um, I bet Johnny will be able to tell you for certain. But if any veterans, well, I don't want to even say veteran service officer, if anyone ever tries to say you need to pay them to apply for a benefit, or sometimes I've talked to another service officer before. There are some people who will have them apply, but then somewhere in the agreement it says if they're awarded the benefit, they give a certain percentage of their benefit to that person. Those are not people that you want to utilize. Um, Unfortunately, because of the PACT Act expansion and just the nature of the VA and these benefits, a lot of people kind of target veterans and trying to get a little bit of money. So the VSOs that are accredited, you can find them on this website as well. I'll try and find the link. But using your state VSOs, I definitely prefer and refer to them very often. But there are a lot of other ones through like Disabled American Veterans, through American Legion and those as well. But um, I think sometimes too, if people apply and they're denied, they might immediately seek legal representation, but then you would have to pay those fees too. So if you work through some of these VSOs, and like Johnny will probably talk about as well, they actually have a legal team that works with them that can kind of help through the appeals process. So if anyone ever tries to ask for money for you to apply for benefits, don't go with them.
Yeah.
You can find someone. It is a free service. It is free for you all. Just remember that.
Right. A veteran should never have to pay for applying for benefits.
Hmm. Bottom line.
Bottom line.
Thanks, Emily, for explaining that, and Gretchen for simplifying it. We have time for two more questions. Brittany is a social worker that works with Parkinson's patients, and they are curious if it would be best for her to refer patients wondering if they're eligible for VA benefits to a VSO or the Parkinson's Foundation's helpline, just to streamline the process for them.
Honestly, I think a VSO would probably be a little bit easier, because that way it will
I
just
agree.
cut down the communication line, and then you can just go straight to the source. So that would be my recommendation.
Same.
I agree. Our last question for this portion of the Q&A comes from Lewis, and they ask, are there any disabilities that the VA recognizes that's connected with the cause of Parkinson's? And I believe you alluded to some of this in your presentation, Gretchen.
So we don't know 100% what causes Parkinson's. That's the biggest problem.
Mhm.
Um, the toxin exposure, there was some research that was done, and it wasn't big, but it was enough for the VA to say, we can't say that Agent Orange or the water contamination didn't cause Parkinson's. So we're going to put it on the presumptive service connected list. Um, so that's a hard question to answer because we don't really know the direct cause of Parkinson's disease. What we do know is that it is on the presumptive list for Vietnam era veterans who were exposed to Agent Orange or were in one of those locations where Agent Orange was considered stored, or if you worked on certain airplanes, then that's Parkinson's and Parkinsonism. For veterans who are the Marines who were stationed at Camp Lejeune during a specific time period, who may have been exposed to the water contaminant. It's presumed if you were there for 30 days, consecutive days, that during those certain years that you were exposed to the contaminated water. So Parkinson's disease is on the presumptive list for that, not Parkinsonism, just Parkinson's disease currently. Um, but it took a while, it took a couple of years, many years for them to add Parkinsonism to Agent Orange. So I'm hopeful that one day that will Parkinsonism will be added to Camp Lejeune as well, and maybe even expand it further. It's not considered presumptive for burn pits, which is what we have a lot of veterans asking about because the Gulf War veterans are now coming into that age of diagnosis of Parkinson's disease, and that's a lot of what people were exposed to were the burn pits. It's not there yet, but hopefully with continued research we'll get there. That's my hope anyway.
Yeah, I was gonna say just to continue to keep your eye on the news and things coming out, because like she said, the Parkinsonism was just added like just a few years ago. So I think they're gonna continue to look at different areas where people served, what things were there, and in terms of like toxins or exposures, and then maybe start making some more research connections in the future.
And there are environmental health examinations that you can register with. So each VA, if you contact your VA's environmental health coordinator, I believe is the name, you
Yeah,
can get your name in a registry. That
I'll
so
get
that
that.
if down the line it comes up that maybe you're service connected for, you have that examination already in the system and can maybe help with making a retroactive claim.
Great. Thank you, Gretchen. And
And I always say, if you think you were potentially your Parkinson's was related to your service connection, or you think that there was a possibility that you were in an area where Agent Orange was present, just apply. Let VBA make that determination. It is a process, but it might be a process that might work out for you in the future.
thank you, Gretchen.
So thank you.
Sharing your valuable time and expertise with us today. If you had a question that was not answered, please reach out to the helpline by calling 1-800-4PD-INFO or emailing our helpline at helpline@parkinson.org. I hope everyone has gained new insights and feels empowered to apply this knowledge to enhance your quality of care and strengthen your connections. And now we'll move into the second half of today's programming, where we will be provided with an overview of VA disability benefits. Johnny retired from the Army in March 2016 after 24 years of dedicated service. She began their journey with the Virginia Department of Veteran Services in September 2018 as a Veteran Service Administrator and was promoted to Veteran Service Representative in March 2019. Throughout her career, Johnny has been committed to assisting departing active duty service members, veterans, and surviving spouses in securing the compensation and pension benefits they deserve. Johnny, we're truly grateful for your time and expertise today. Thank you for being here.
Hi, thank you for having me. I do appreciate this. I learned a lot from Miss Gretchen and Miss Emily. Thank you. Um, I am a veteran service representative for the state of Virginia. And next slide, please. Okay. So what if a veteran representative, what do? We help file claims for the veterans and their family members. And we also help file claims for departing service members. We will have access to your VA file once we do the representation form, and then we can actually review decision letters that the VA gives you. That's one piece. Someone asked about an accredited VSO in the last piece. An accredited VSO will have access to your VA file, and yes, they will not charge you money. We do not charge money at all. We as VSRs can communicate with the VA on your behalf. If you have a question and you don't want to speak to a VA representative, we can call on your behalf and ask that question and get the answer for you. We provide free services for veterans and the family members. We also have to complete training and pass an accredited test. That's one way to make us accredited. It's roughly 120 question test, and we do have to pass it to receive our accreditation through the VA itself. And we, our VS representatives, VSRs, we work with American Legion, disabled veterans, VFWs, AMVETs, wounded warriors. Those all have VSOs and VSRs. Each state by law is required to have either a state level VSO or county level VSO. So that is mandatory and that is law. So every state has a veteran service representative and organization assigned to that state, whether it's state level or county level. Next slide, please. So our purpose is designed to compensate veterans for diminished work capacity as results of a disability that occurred in military service. So the condition that you are trying to claim has to have happened while you were on active duty, or is well documented in your military medical records. But in this case, Parkinson's, due to Camp Lejeune contamination, water contamination, Agent Orange exposure is presumed. It is presumptive. So I don't want to say it's automatic, but it's kind of automatic, especially if you were boots on the ground Vietnam and in the locations designated by the VA. You must be a veteran. You must provide a DD 214 to be eligible. The requirements are related to in-service injury, illness, or hazardous exposure. Disability compensations can open doors to additional benefits such as health care, as Miss Emily and Miss Gretchen spoke of earlier, health care, and then also like caregiver support programs and stuff like that. There is no time limit to file a claim after service. We still have veterans today that are Vietnam veterans that are filing. We even have some that are a little bit before Vietnam that are still filing claims. And the VA is processing them. There's no time limit whatsoever. Next slide, please. So when you come to us, to a VSR, we will complete all the paperwork for you. You will sign the documentation. You will give us your supporting documentation. For Parkinson's, we need a current diagnosis. For any presumptive of Agent Orange or Camp Lejeune, you need a current diagnosis of that condition, whether it's Parkinson's, hypertension, etc. A current diagnosis is all you need for a presumptive. You do not need a nexus letter. Disability ratings are based on the current severity of that condition that you have. And it does go it's by law, 38 CFR Part 4 is the one where the rating schedules are given. And like it was spoke of earlier, the ratings are 0 to 100%. Even if you have a rating of 0, you can receive treatment from the VA. If it does get worse, you can request for an increase if it does get worse. Ratings are monthly compensations for the rest of your life. Age is not considered in the worsening of the disability. Just please keep that in mind. The payments are tax-free. It's assigned based on your combined rating. And this is paid for the rest of your life. Next slide, please. So disability compensation requirements for service connection: an in-service event, injury, or exposure, current diagnosed disability, and a nexus. If you're not applying for a presumptive condition due to Camp Lejeune or Agent Orange, you do need a nexus. If you are filing for a presumptive, you do not need a nexus. You just need that current diagnosis. Next slide, please. So Parkinson's, it is a neurological condition, convulsion disorders, diagnostic code 8004. This diagnostic code automatically is a minimum of 30% for that condition, but it does not take into account the symptoms associated with it. So majority of the time, I'm gonna say majority, Parkinson's is rated at 30%. But once we know Parkinson's always gets worse, so you start to get your symptoms. And as you get more symptoms, you file for those symptoms. And that will be on the next slide. Next slide, please. So the symptoms of Parkinson's, we have this little the slideshow. So we file for Parkinson's itself, and then say a couple of months later or a little bit later, okay, you're now having symptoms of Parkinson's. You're having the depression, you're having the constipation, you're having the mouth difficulty speaking, the excessive salivation, or the tremors. So if you want to file for those conditions, you go back to your doctor, your neurologist, I believe it is, the doctor you see for your Parkinson's. You say, okay, doc, I'm service connected for Parkinson's, but now I'm showing more of the symptoms, the constipation, the tremors, the difficulty speaking, of feeding myself, difficulty swallowing. Have your doctor write up another letter, another memo saying, I am treating Mr. Veteran. He is diagnosed with the Parkinson's disease. He now has symptoms of Parkinson's, and have your doctor list those symptoms, depression, anxiety, whatever it may be. You take that memo back to your veteran service representative, and your veteran representative can do another claim for you saying, okay, he now has, we call it residuals of service-connected Parkinson's, whether it's constipation, tremors, the depression. We would list all that on the 526EZ that we fill out for you. And then we would submit that with the memo from your doctor stating that he now has these symptoms, and that will add to your 30%. So that 30% that was just for Parkinson's is now possibly up to 100% because you've added all those other symptoms, and it adds to your rating disability. Now, the rating disabilities of the VA, I really don't want to get into it, but if you are service connected with the VA, you know 10 plus 10 with the VA equals 19. So it's not math, it's not straight math. I can't really explain it because I'm not an engineer, but it's just, we know how to read our rating stability chart, and then we can kind of explain why 90 plus 10 equals 91 and not 90 plus 10 equals 100. But that's a whole different story. I just wanted to put that out there. These are our references. For the VSO, I do have that the same as Miss Emily had. va.gov, get help from an accredited representative, find a rep. There is a little search bar. You can type your state, like New York VA rep, or VA New York VSO, and then New York will pop up. So you can do it that way, or you can click the link right there, and then it'll bring up your states and the representative near for you. Okay, I know that was very fast, and I do apologize, but what are your questions?
Thanks so much, Johnny. I appreciate it. I know it's challenging to navigate conversations and receiving benefits through the VA, and so grateful that there are people like you who are helping our community receive the benefits that they so deserve of their service to the country. So thank you for doing what you do, and knowing that it's really appreciated and certainly acknowledged by the Parkinson's Foundation.
Well, thank you.
I'm curious, one of our viewers, Brittany, is asking, what's the best way to locate a VSO near you? And I think you touched on it just now with that link. So simply Googling a VSO near whichever city, what would be the best way that you would recommend, Johnny?
So if you wanted to make sure it's accredited, you would want to use the va.gov website. And there is a little search bar at the top with a magnifying glass. That's where you would want to type in VSO and your state, and then that would populate right there. and we would know those are, I want to say the VA's already, the VA's already vetted them. And then of course, we don't charge.
Thank you, Johnny. I did just receive a question that seems very specific to this particular individual's circumstances, and I would recommend to this individual who writes that they're 11-year active duty U.S. Navy veteran to contact their VSO, just thinking about if there's any hope that for their situation to have a closer evaluation of being connected to their injuries and limitations and now. So I'm not going to read the whole question to you, Johnny, because it is very specific and I believe outside of both of our practices to address in the objective of today's webinar. So really appreciate your patience with me, my friend, and want to direct you to the resources that are most helpful for your question. Does anyone else have any questions related to being connected with a veteran service representative or officer while we have Johnny here to support our navigation in receiving benefits? And we'll just pause for a moment, Johnny, while people write in. Gwen, I see your question about cognitive challenges associated with Parkinson's disease. I'll invite you, Gwen, to tune into our mental health webinar where we will dive deeper into the mental health implications of Parkinson's disease, and that program will be in February. We also have lots of resources related to general Parkinson's information and education on our website.
The VA does, I'm sorry. The VA does Service Connect for cognitive conditions when it comes to Parkinson's. Yes,
That's really helpful to know. Thank you for sharing that, Johnny. One of our viewers is asking, should I put a claim in if I'm already at 90% service connected for mental health and sleep apnea? Is that something you can address, Johnny?
yes, ma'am. So for behavioral health, you can, as long if you had those conditions while on active duty, or if you were in combat, the VA may service connect the behavioral health. The sleep apnea is a little more tricky because everyone has sleep apnea, but our advice is if you did not have it in service and you were diagnosed you never went to medical and you didn't complain of sleep issues, more likely than not, the VA may not service connect. If you are service connected for behavioral health, and your psychiatrist is willing to write a nexus for your sleep apnea secondary to your service connected behavioral health, you can try that way. But the VA is, I don't want to say picky, but they scrub sleep apnea claims a little bit more than a regular claim. I don't know if that makes sense.
What would you recommend to our friend here who's inquiring about sleep apnea? Where would they turn to get some answers about that?
So get your sleep test, get your current sleep test, get your strong nexus letter from your doctor that you see for sleep apnea. You can write your statement on sleep apnea. If you were married or had a roommate or something and you still speak with them, they can write a statement on your behalf too. It's just that strong nexus letter that you will need from your doctor that states more likely than not, your current diagnosis of sleep apnea is related to your military service.
Jane is writing in, I'm still confused about benefits for non-service related Parkinson's. Where do we start?
So they are not service. Sorry, am I understanding they are not service connected for Parkinson's?
They don't describe themselves as being service connected or not, but confused about the benefits related to being non-service connected.
So non-service connected, like Miss Emily and Miss Gretchen spoke of earlier, you can receive health care. You may have a small down payment or a small copay. But as for receiving monies on a monthly basis from VA, you will not receive that. That's for service connected only.
Thank you for sharing, Johnny. Appreciate you clarifying that. James is asking us, how can we find out what PD symptoms have been used to assign our current rating and what our current rating is?
So you would contact the 1-800 number or your VSO. Your VSO would have access to your VA file, and we can see exactly. So your Parkinson's 30%, the tremors are 10% or whatever it may be. Your VSR can look at your VA file and tell you exactly what disabilities your percentages are for.
Very helpful. Thank you. And we'll be able to offer that phone number at the end of the program. You'll all receive resources and a link to a full white paper of resources and links to connect to. Thank you, Emily, for continuing to drop some resources in the chat as well. Johnny, one of our viewers, David, is asking what benefits are available for spouses of veterans?
So as long as as long as the veteran is alive, for VA purposes, they will go to the veteran. Once the veteran passes, and depending on your rating, I should say that too. If you're 100% PNT, then your spouse may be able to get VA health care, but that depends on your rating. So, but once the veteran passes, and he passes from a service-connected disability, as long as that is listed on the death certificate, the surviving spouse will then be eligible for what's called dependent indemnity compensation, DIC. But his service-connected issue has to be on the death certificate, or he has to be rated at 100% PNT for 10 plus years.
Hi, thank you for outlining those benefits for us, Johnny. And I know it can be a little bit confusing, which is why people like Johnny are here to serve us and answer these questions on a more personal level. So I strongly encourage each of you to find your VSO nearby and start that dialogue with someone who's able to support you through navigating these questions, the systems, and being connected with the services that you deserve. We have another question for, I'm not sure who asked this one, but why is it not feasible anymore to obtain copy of one's DD-214 at CVSOs? What options are there now for doing this?
So if you're trying to gain your DD-214, you can go to archives.gov, G-O-V. Do not go to archives.com, because .com will charge you. So please go to archives.gov. But if your VSR has a copy of your DD-214, I know we can for the state of Virginia. I can't speak for other states. If we have a copy of your DD-214, we can give it to you, of course. Or go to archives.gov.
Archives.gov. Thank you
Yes.
so much. Can you say what a DD-214 is?
It's a your discharge paperwork that you receive once you're out of the service. It tells you your time in service, your rank, and then your character of discharge also. And it says your awards and stuff like that. For Vietnam vets, it's important that they have the Vietnam Service Medal, the Vietnam, there's another Vietnam citation on there too. And that's how the VA, they were in Vietnam. So yes.
Johnny, are you aware if a service member of the Navy, 6 years active duty, are there any benefits for hospice?
I would have Miss Emily or Miss Gretchen answer that, because that's more health care, possibly.
Fair enough.
I do apologize.
Oh, I appreciate your ability to acknowledge where you don't have the answers. Gretchen, I see you're here. So do we know if there are benefits related to hospice?
There are. If you're eligible for VA healthcare and you receive VA healthcare, we do have hospice teams through the hospital. We also have many VAs, not all, but many VAs have hospice unit, oftentimes at their nursing home. Well, that's where we have ours in Philadelphia. There is also an option to have hospice covered from the VA if you're at home too, but you have to get all that authorized through your primary care team, or if you're affiliated with a PADRAC, it has to all get approved through the VA before they'll start paying for it. So if that's a question, talk to your VA provider, your healthcare provider. They'll connect you most likely with a social worker and possibly the palliative and hospice team at your VA to determine if you're eligible for it. But it is part of the benefit.
Feel free to stay on, Gretchen. We have an interesting question that I think would be curious to ask out loud. So one of our viewers is sharing, my partner's service record does not reflect any service because he was on top secret assignments. Can the VSO gain access to those secret assignments? He's been unable to obtain benefits for his Parkinson's, which he believes is connected to those assignments.
That's a tough one
What
that
I
we hear a lot.
Yes. There, not that I can think of. I mean, maybe they're declassified by now, so maybe he can contact his branch of service. Because I'm sure they have something on record if it's declassified by now. But as for like public, no, it has to be declassified. Not that I know of.
It is a
That's
challenge that we've heard. You're not alone. We've had some I've heard this challenge before.
Yeah.
And unfortunately, I don't, and it sounds like Johnny doesn't, we don't have a good way to direct you except to keep trying.
keep trying. Yeah. And I didn't
If they
sound,
maybe have,
go ahead,
okay,
Johnny.
if they may have received like an award or something that says, hey, you were in Vietnam, or something that states that they were in Vietnam, or the location, maybe, I mean, even if it's not a DD 214, that's proof right there of some sort, possibly.
I love your optimism.
Mhm. You got to get creative sometimes and just try.
Yes.
That's what we say. You just have to, work with us, work with the veteran service officers to just brainstorm together what maybe that's what we do. We're your advocates and we'll try our best. We can't always make it happen, but we'll certainly try.
Mhm. Yeah. Yeah. I am just really quickly looking through the open questions right now, to see if there's one that's relevant to today's subject. And if you're asking for more specific information, I highly recommend you reaching out to the Parkinson's Foundation's helpline. They'll be able to guide you with more specific, your specific questions and resources that can support you. All right, here's one. Got it. So Glenn asks, do I still need to pay Medicare premiums if I have 100% service-connected disability and receive all care through the VA?
So
That's Gretchen.
my suggestion is always to keep Medicare Part A because you don't pay for that. And if you call 911, 911 is going to take you to your closest hospital emergency room. They're not going to transport you to the VA. So if you don't have Medicare Part A, you're going to get stuck with that bill if you don't have any insurance. And we can't guarantee if it's not related to if you're service connected, one of your service connected conditions, if the VA is going to necessarily pick up the cost of that hospitalization or the ambulance ride or anything like that. So I always recommend that you at least keep A. B, it's kind of up to you.
Mhm.
If you chose to want to get a second opinion at some point, the VA does not necessarily have to agree to covering that second opinion if we provide the care at our hospital or at the VA. So if you wanted a second opinion and the VA wouldn't send you out for it because we already have the specialists here, you would then have to pay for that outpatient care that would fall under B. But I'm curious
Mhm.
if Emily and Johnny have anything different that they say.
I definitely think I mean, like Gretchen said, it's not required. If you're 100% disabled and you get everything through the VA, you're not required to keep Part B. I just, as someone who also works at a community hospital and see a lot of veterans that come through those doors as well, it opens up a lot more flexibility and options as far as community care, or if you needed to have short-term rehab done at a facility that is close to your house versus trekking to the VA. So I think sometimes it's nice for having a little bit more as far as options. Now, some of these Medicare Advantage plans, which I could go on a long rant about, um, where sometimes the costs through the premiums are really, really high. I think kind of weighing your options on that and seeing, whether or not you feel like that plan is right for you. Because again, if there are specific programs within that you utilize, that's great, or providers that you see with it, it's great. But most of those programs are usually a little bit more costly. And if you are 100% that you have that dental eligibility, which a lot of times people will pick those plans, the Medicare Advantage plans, because they have dental in there. But if you're 100%, you can use dental through the VA, which I think is also a really big benefit, honestly.
All right, my friends and community, thank you all so much for sharing your time with us today. A big thank you to Johnny for generously sharing your expertise. I hope everyone has walked away with fresh perspectives and feels motivated to use this knowledge to improve your care and deepen your connections. A message that I'm receiving from today is keep trying, keep asking. You don't know the answer unless you ask the question. So continue to poke and prod and nudge your community members who are supporting you through navigating the VA system. Continue calling the Parkinson's Foundation helpline, send us emails, ask the questions, keep trying. Today's webinar and the entire Veterans webinar series is presented with support from the Don and Lorraine Freeberg Foundation. We want to take this moment to thank the Freeberg Foundation for helping to make these programs possible. Join us for the second program of our Veterans webinar series, Care Partners of Veterans with PD, on December 12th. This program provides essential guidance for care partners of veterans living with Parkinson's disease. You will gain insights into effective strategies for navigating evolving roles and accessing beneficial support services. Join us to deepen your understanding of the comprehensive care services and caregiver resources provided by the VA and the Parkinson's Foundation. You can find more information and register for the program on our webpage at parkinson.org/veterans. In the same vein of providing resources for care partners, join us this November for our Care Partner Summit webinar series designed specifically for those supporting someone with Parkinson's. Whether you're new to the role or have been caring for a while, these webinars will offer valuable strategies for managing Parkinson's, maintaining strong relationships, and navigating daily challenges with confidence. Our expert panelists, you will be hearing from people who are living with and impacted by Parkinson's disease. They'll offer you practical tools to support you every step of the way. So we are hosting 3 webinars throughout the month of November. You can sign up for all 3 of them, or one that speaks to you the most. Again, you can scan that QR code on the screen or visit our landing page, our webpage at parkinson.org/summit. The Parkinson's Foundation wants to hear from you. Through our PD story page, the foundation shares stories written by anyone in the Parkinson's disease community. These stories help bring awareness to this life-changing disease and helps to inspire others. As a veteran of a loved one caring for someone with Parkinson's disease, your experience is unique. We encourage you to submit your PD story and share your experience with others in the community. You can visit parkinson.org/mystory. And don't forget to visit our webpage, explore the resources offered by the Parkinson's Foundation that can support your navigation of living Parkinson's as a veteran. That website's parkinson.org/veterans. If you had a question today that was not answered, please reach out to our helpline by calling 1-800-4PD-INFO or emailing helpline@parkinson.org. You can use that same contact information to order our free resources, educational book series, and our hospital safety guide. We thank you for joining us today and hope to see you again soon. Be well and keep trying.